So in this session, we'll discuss about testis. Testis is a male reproductive gonad suspended in the scrotum by the spermatic cord. It is ellipsoid in shape. Left testis lies 1 centimeter below the right testis because left spermatic cord is slightly elongated than the right one. The testis is oblique in direction. Upper end tilts forwards and laterally. You can see here, this is the testis, this is the epididymis, and this is the appendix of testis, this is the appendix of epididymis, this is spermatic cord. You can see here, this is a scrotal ligament. You can see the dartus muscle. Length is approximately 5 centimeters, breadth 2.5 centimeters, thickness anteroposterior is 3 centimeters, and weight is 10 to 14 grams. Presenting parts: two ends, upper and lower ends, two borders, anterior and posterior border, two surfaces, medial and lateral, and then epididymis. Upper end overlapped by head of epididymis. Appendix of testis, a fibrofatty body is attached to it. It's a remnant of cephalic part of the Mullerian duct. Lower end connected to tail of epididymis by areolar tissue and tunica vaginalis. Borders: anterior border, it is smooth and convex. Posterior border, it is broad and flat, occupied posterolaterally by the body of epididymis and posteromedially by the vas deferens. Spermatic cord is attached to the upper part of the posterior border. Medial surface smooth and convex. Lateral surface is also smooth and convex. Lateral surface is overlapped posteriorly by the epididymis, separated by a semilunar recess of the vaginal sac, the sinus of epididymis. It helps in site determination. Epididymis, it's a comma-shaped body located along posterior border of the testis. Consists of head, body, and tail. Head is formed by coiling of the efferent ductules. Each coiled mass is conical in shape and forms lobule of epididymis. Appendix of epididymis attached to head of the epididymis. It's a remnant of degenerated cephalic part of the mesonephros. Body and tail formed by coiling of single duct, canal of epididymis. Vas deferens begins as a continuation of the tail of epididymis. Coverings of the testis: three coverings from outside inwards: visceral layer of the tunica vaginalis, tunica albuginea, and tunica vasculosa. Visceral layer of the tunica vaginalis. So tunica vaginalis develops from distal part of the process vaginalis of the peritoneum. It has two-parted parietal layer and visceral layer. Parietal layer lines the inner aspect of scrotum, whereas visceral layer lines the testis and epididymis except posterior border. Both layers enclose a closed vaginal sac. Accumulation of fluid in this sac results in hydrocele. So tunica albuginea, it's a thick fibrous membrane, invests entire testis from posterior part of the testis, projects into testis as an incomplete vertical partition known as mediastinum testis. Fibrous septa extend from mediastinum testis and divide testis into a number of cone-shaped compartments called lobules of testis. Each testis is having 200 to 300 lobules. You can see here, this is the mediastinum testis, and you can see the septa extending from mediastinum and dividing the testis into lobules. Each lobule is having seminiferous tubules, 2 to 3 seminiferous tubules. You can see here, this is the mediastinum testis. So these are the septa extending from mediastinum testis and dividing the testis into lobules. And you can see here, this is the vaginal sac, and you can see the sinus of epididymis between epididymis and the lateral aspect of the testis. This is the sinus of epididymis. Tunica vasculosa, it is areolar and vascular membrane, lines individual lobules of the testis. Extrinsic coverings are nothing but the layers of the scrotum, skin, dartus muscle, external spermatic fascia, cremaster muscle and fascia, internal spermatic fascia, and parietal layer of the tunica vaginalis. So macroscopic features. So each lobule will have three seminiferous tubules. Seminiferous tubules have convoluted part in front and straight part behind. Uncoiled length is around 2 feet, approximately 70 to 80 centimeters. 400 to 600 tubules are present in each testis. Straight parts of seminiferous tubules ascend in the mediastinum and joins with adjacent tubules to form plexiform network of tubules known as rete testis. So 10 to 20 efferent ductules arise from upper end of the rete testis and enter in the head of the epididymis. Each efferent ductule forms a cone-shaped conical mass called lobule of epididymis. Uncoiled length of the ductule is 15 to 20 centimeters. It's around 6 to 8 inches. Efferent ductules unite to form canal of epididymis, which by convolutions form body and tail of epididymis. Uncoiled length of canal is around 20 feet, around 6 meters. So, in addition, there might be aberrant ductules, superior aberrant ductule and inferior aberrant ductules connected to head and tail of epididymis respectively. So, remnant of proximal and distal mesonephric tubules. So microscopic features. So microscopy of the testis will be dealt as a separate class, histology of testis. So here we'll just remember these three important cells in the histological aspect of testis. That is spermatogenic cells for production of sperm, cytotory cells for supporting the spermatogenic cells, and interstitial cells of Leydig for secreting the testosterone. You can see this is a section of a testis. You can see all these are seminiferous tubules, and you can see here this is the lumen of the seminiferous tubules. You can see different spermatogonia and spermatocytes. So this is an enhanced image. You can see here this large nuclei are the Sertoli cells, and these are the developing spermatogonia. Arterial supply, it is supplied by three arteries: testicular artery, which is a branch of abdominal aorta, and artery to vas, which is branch of superior and inferior vesical artery, and the cremastic artery, which is branch of inferior epigastric artery. Venous drainage, 15 to 20 veins from posterior part of the testis and epididymis will emerge and form pampiniform plexus. At superficial inguinal ring, they unite to form 4 veins. At deep ring, they unite to form 2 veins. Single vein is formed in posterior abdominal wall. Right testicular vein drains into inferior vena cava, whereas left testicular vein drains into left renal vein. So vertically, I'll show you in the next diagram. That's the commonest cause of varicocele on left side. So countercurrent heat exchange occurs between testicular arteries conveying heat and veins absorbing heat, leading to lower temperature of the testis. So this plexiform veins will be around the testicular artery. So the hot blood which is reaching the testis will be cooled by the veins, the blood in the veins which is going towards the abdomen. You can see here these are the pampiniform plexus of veins. At superficial inguinal ring 4 veins, at deep ring 2 veins, in the post-abdominal wall single vein. And see, the right gonadal vein is draining into the inferior vena cava obliquely, whereas the left gonadal vein is draining vertically into the left renal vein. So this left renal vein has a chance of compression between the superior mesenteric artery and abdominal aorta as a nutcracker phenomena. So lymphatics drain into preaortic and paraortic lymph nodes following the course of testicular vessels. Now supply sympathetic nerves by renal plexus and aortic plexus. Segments are T10 and T11. That way pain in the testis will be radiating to the umbilicus because of the same segmental innervation. And you can see here descent of testis. This is the gubernaculum of testis. It is just acting as a guide for the descent of the testis. You can see here gubernaculum forming the scrotal ligament. Factors helping in descent of testis are the gubernaculum testis, which is acting as the guiding force of descent. Then intra-abdominal pressure helps in rapid descent along inguinal canal. So intra-abdominal temperature, testis require lower temperature for spermatogenesis, so descent to scrotum. Arched fibers of the internal oblique, they help in descent through the inguinal canal. Uncurling of the fetal curves drags testis downwards. Then internal secretion of the fetal testis, the interstitial cells, also helps in descent of the testis. So failure in descent leads to anarchism or cryptorchism. Testis remains in abdomen. Monarchism, one testis intra-abdominal, one testis in normal position. Partial descended testis, it can lie anywhere along the path of the descent of the testis. Archidopexy is the preferred surgical procedure for remobilization. The ectopic testis lies in perineum or in front of the symphysis pubis. Completely patent process vaginalis. It's a cause of congenital inguinal hernia. Encysted hydrocele of spermatic cord can occur where patent middle part of the process vaginalis is seen. Inversion of testis, process vaginalis extends behind the testis and makes the posterior border of testis free. Thank you.